Health Minister Ong Ye Kung says Singapore's COVID-19 wave has reached its peak and infection numbers are expected to come down. But he cautions that festive gatherings might trigger another wave of infections. They soared to over 58,000 last week, the highest all year. Even so, Mr. Ong stresses there are no plans to reinstate safe distancing measures. He also calls for all to keep up to date with their vaccinations to ease the burden on hospitals.
About 600 of our hospital beds are taken up by COVID patients. 10, 20 ICU beds are taken, which is not high. For hospital beds at 600 or 700 hospital beds, it is quite a drain on our system. We are a 10,000 bed strong system. To take up 700 beds and take 6-7%, which is not small. It's a significant workload on our healthcare workers and our system.
Minister Ong was speaking at the opening of the country's newest hospital, that's Woodlands Health. We'll have more on that story later on this bulletin. But in the meantime, COVID cases might have peaked, but Singapore companies are not taking anything for granted. They're ramping up measures to minimize infections. Alif Amshar reports.
This tuition centre in Punggol runs 6 classes every day. With the recent wave of COVID-19 cases, it's bringing back some familiar practices. For example, asking students to sit further apart from one another.
As much as possible, we try to use up all the classrooms so that we keep the numbers in one class small, so that the virus transmission isn't that high in the environment.
The centre has also ramped up cleaning. It's doubled how often it conducts a thorough wipe down, now doing it twice a week. Doorknobs and light switches are also sanitised daily. If the situation doesn't improve before all its students return from the holidays in January, the centre is prepared to do more.
We probably have to start going back to the temperature taking thing, make sure that the students are well. Those who may have an alternative to stay at home, we can do online classes with them.
This food caterer is erring on the side of caution to avoid a 1-2 punch during the hectic festive period.
Currently, to ensure our operation efficiency, we are actually taking in 20% less orders, just in case if we have people that test positive or things like that, so we can still find contingencies.
To fulfill orders on time, it's hired temporary drivers to step in for staff who've caught the virus.
This is a problem that may last longer than it should. We do not want to call our clients to say, I'm sorry, I'm a driver down, will not be able to commit to your order placed, things like that. So we probably will be doing this all the way until the Chinese New Year season.
Average estimated infections have fallen every day this week. Despite this seeming turn for the better, Mr. Heng says he'll continue with his plan, as it's better to be safe than sorry.
Health Minister Ong Ye Kung also said his ministry will look into cases of individuals who feel they have been left out of receiving COVID-19 resilience medals. This award honours those who made key contributions to Singapore's fight against the pandemic. His comment comes following an open letter penned by an anonymous group of healthcare workers. They asked why some frontliners were excluded from this award. The letter was published on Monday and called for the Health Ministry to clarify the nomination process for the awards. More than 110,000 people have received the medal thus far. In response, the Health Ministry says it took an approach to be as inclusive as possible when awarding the medals and maintains a rigorous nomination process. However, it does acknowledge that not everyone who contributed to Singapore's fight against COVID-19 was awarded.
It is possible that we missed out some, and if we do, the exercise is over, but we will try our best to make it up as much as possible. There is, however, one anonymous group who apparently they are doctors in isolation wards. They claim that they have also been missed out, but they are anonymous, so I do invite them, please give us your name and the hospital you work in, and we will certainly look at your cases objectively.